Jimmo-Dixon, Margie, at the North Cowichan Fire Department. My last bench is the oxygen therapy unit. What is it? It's an oxygen therapy unit. And what is it used for? It's used to increase recovery and chance of survival of a patient. It's used to reduce or prevent shock, to calm a patient down, but primarily it's used to supplement oxygen to a pre-hospitalized patient. That is exhibiting signs of hypoxia. And hypoxia is simply a lack of oxygen, so it's an inadequate oxidation of cell tissue. And what causes hypoxia? Hypoxia would be caused by anything from an allergic reaction, blood loss, crush injury, cyanosis, loss of consciousness, vomiting, nausea, extensive burns. If you had a spinal injury, all these things will cause hypoxia. What are the benefits? Oh, sorry?
Can you go back to cyanosis?
Mm-hmm.
Do you know what cyanosis is?
Yes, it's when your lips are turning blue and your fingertips and your nail beds and your earlobes can turn blue.
Okay, so does that cause hypoxia or is it the other way around?
That is a sign of hypoxia.
There you go. Okay, thanks. Yeah.
Yes, so causes and signs up. Okay.
Okay, good.
Benefits of oxygen therapy. One is an oxygen supply to the brain to maintain central nervous system and vital body functions. You'd be getting oxygen to the heart muscle. It would be delivering oxygen to, you get a better gaseous exchange at cell tissue as well as in the lungs. You would, especially if you had a chest injury, you would reduce the depth and the rate of breathing, which would help, and you would reduce the workload on the heart as well. So if they had a chest injury, it would be a lot more comfortable to breathe. If there was a partial obstruction, you would be able to deliver a much more enriched volume of oxygen to the lungs, and it's going to calm someone down who's anxious. And if I'm giving someone oxygen, what are signs that it's actually working? I'm looking for an increase in color, I'm looking for an increase in consciousness, I'm looking for a reduction of anxiety, a reduction of the breathing rate, reduction of pulse rate, and reduction in pain. Okay, this is there are three components to the system. There is the cylinder itself, the regulator, and the face mask. These cylinders are seamless stainless steel. They're hydrostatically tested every 5 years. They have a chrome post and indexing, which will only fit the regulator for O2. And it is a chrome post because it is less likely to spark, because O2 under pressure, if there was petroleum products around, it dangerously reduces the flash point and ignition point of that. So it could cause fires. Other things to remember when you're using oxygen therapy, you want to make sure nobody's smoking, that the person that you're administering the oxygen to doesn't have any grease oils on them as well. That's it for now. I'm going to move on to the regulator unless you have a question.
No, carry on.
Okay. The regulator is a clamp system. It has an index and pin as well, and it needs to fit onto this post. And it will only fit onto a medical post that's on the cylinder. Actually, I'm going to back up just a minute here on the cylinder. This is 2,000 PSI, this particular cylinder, and it is a D-size unit. D-size is 412 liters, and just as an aside, there's also an E-size, which is 682 liters, and a K-size, which is 6,900 liters. And there's a really rare one called a Stewart, and that's 480 liters. Now, if I was to administer a 10-liter flow, I would get 38 minutes out of this particular bottle. The 682 at a 10-liter per minute flow, I would get 68 minutes. And out of the 6,900 liter, I would get 10 and a half hours. Now, there is a simple calculation for that, but what they suggested in the manual to do was to take the chart that they had in the book and just put it inside your case so you have it all times, because it is much better to deliver an ongoing supply of oxygen to someone. So you might, if it's going to be 60 minutes to your destination, you might want to reduce your flow to 6 minutes, 6 liters per minute instead of 10, because you don't want to abruptly stop somebody when you have them on oxygen. Okay, so back to the regulator. Sorry. The regulator is a clamp valve system. It has 2 gauges. This one indicates, once it'll be turned on, it'll indicate the 2,000 PSI, and it's turned on by a ratchet valve system. Now, if it was a brand new bottle, I would actually just crack this, before I put my regulator on, I'd crack it just a half turn and purge so that if there was any debris in the indexing and pins, that it would blow it out. Then I'd put my regulator on. I'd charge it. So this is my the regulator and gauge. This regulator takes my 2,000 PSI to somewhere between 40 and 70 PSI. And this gauge is my final part of the regulator, and it regulates my flow. And the flow will be determined by the medic. So it'll be somewhere between 6 to 10 liters per minute. Now, okay, so.
Not less than 6?
It could be less than 6, but that's going to depend on the medic, and he would have to explain to me why, because on average it's 6 to 10. I suspect if somebody had COPD, it might be less, but that's not touched on in the manual.
No, and they don't touch on the less than 6, but the reason why it's not less than 6, just so you know,
Okay.
is that you're breathing in that mask, and if less than 6, you're actually depleting yourself of oxygen, because the flow is so low, and you're breathing back your own air,
Okay.
right? Your exhaled air.
Okay.
That's why never less than 6.
They're never less than 6 then. I'll go with that.
With that kind of mask.
Okay, and that gets us to the third and final component, which is our mask. This is a bit different than what we have at Minto, but this is a partial non-breather. It has a reservoir, and it has tubing that is not easily crushed. Okay, one end of the regulator, one end of the hose will go on the regulator, and the other end on the face mask. You use a new unit every time. They come packaged like this, they're sterile. One thing to remember when you're giving this to the patient, always purge the face mask first as well, for the same reason as we purged the original system, and then give it to them. The oxygen is going to go into the reservoir, and that enables them to breathe just about 100% O2, and as they breathe out, there is a valve here, or an opening, where they'll expel air. They'll also breathe in a little bit of atmospheric air, but the majority of it will come from the reservoir, which is just pure oxygen. When you're going to give a person a mask, ask them if they've ever used one before, because it can be quite claustrophobic. So get them to put it on their face and hold it there, and once they're comfortable, you can take the elastic straps and put it around their head.
Okay.
Okay? Once you're done with this unit, you would shut it down, and you would purge it.
Okay.
Okay?
You can go ahead and show me that.
Okay. So we can turn it on. There we go. I'm going to stabilize the gauge, and then we could go to a full turn. Oops. There we go. Okay. And you can listen here. There is my flow. I'm going to shut it down. Okay. And it's, well, maybe I didn't leave it running long enough. I'm not
No,
quite
you
sure.
purged it.
And that purged it?
Okay, purge it, yeah.
Okay.
It let out before you
Yes,
closed
I
it.
expected it to purge for a little longer than that.
Right,
but
yeah,
that-
it's pretty quick. It's
So
not
once
a
it's.
small chamber.
Yeah, once it's shut down, and then you're going to reset that back to off.
Good.
And you're always going to store this securely in
Okay,
its-
before we stow that,
Yep,
you were talking about the pins and stuff, so I'd like to see those.
sure. Okay,
We're down to 4.5 minutes left on this
Okay.
video.
so this is you have to make sure that you line this up.
Okay, sorry, I didn't, yeah. that's
Okay.
good. Point out
So the
pin.
two pins
Okay, I get
and
you.
the valve.
Oh, hang on.
And
Video. Okay,
Okay.
there they are.
And
Sure.
on the regulator, there is a valve. I was going to say a washer, and I'm not quite sure the exact word, but it has to be changed with every new bottle. So
Okay.
don't lose that, because that will affect the seal. And then you can put it back on, and tighten it. And we're good to go.
Is there anything special about that tag there?
Do not remove the tag. This indicates the date of expiry, and it tells you how many cubic feet it is. And I don't know if that was stamped the day that it was examined.
So, the thing about these tags is, and this one wasn't done properly by whoever put this bottle in service, as soon as this regulator goes on, this little bottom tag, perforated ticket, should be torn off.
Okay.
So it's perforated, so go ahead and tear that off, because that
Indicates
bottle
that
is
it's-
now in use, right?
Okay.
There you go. And then once it's empty, we take it out of service, what are you gonna do?
Tear that last one off.
Yeah.
And give it to whoever refills them.
Right, good.
Okay. Perfect. So as I said, you're going to store it on its side in a secure case. And if you happen to store them upright, you're going to make sure plugged up here. You're going to make sure that it's either secured in a box with 4 sides or some kind of chain so that it can't fall over. Any other questions, Rob?
That was pretty awesome, Anna. All your demos today were really awesome.
Out. I'm out.
All right. Bye, Anna.